Thanks, Casey. The overwhelming health and well-being of ourselves, friends, family, and loved ones is of utmost importance to us. Well, here at the Sage Neuroscience Center, they offer a unique practice, and let's find out a little bit more about it. I'm here with Dr. Ruben Sutter and Dr. Lynn Bryant. Thanks so much for being with us today.
Thanks for having us.
Thank you.
So tell me, what is integrated primary care, and how is it different than other primary care services?
So it's really exciting to be able to provide that, because integrated care really is providing primary care services or family practice services alongside of behavioral health services, and so we can co-inform those things across those lines within the same place. And so we can basically share information, share care, and really provide better care, frankly, for our patients.
So why is there a need for integrated primary care?
Well, most behavioral health patients don't feel very comfortable in their primary care doctor's office. There's a stigma sometimes associated with it. It's just not a comfortable place for them. And a large percentage of behavioral health patients haven't taken care of their primary care.
Mm-hmm. And I would add, too, that people with primary care issues that also have significant behavioral health problems often end up requiring about 2 to 3 times the level of care that just somebody that has physical health issues. And I think largely that's because their care isn't being coordinated or provided properly, really.
I understand. Now, tell me, what are some of the symptoms that can present themselves as primary care issues, which end up being, behavioral care issues and vice versa?
Well, one of the chief ones I think I see is palpitations. A person comes in with palpitations and there are so many things that can contribute to that, but it's not necessarily cardiovascular disease. It could be anxiety, it could be a lot of other things.
Yeah, and really, I mean, you got this brain-body connection in which everything that goes on in the brain is connected physically, and physically affects our brain, that oftentimes if I have behavioral health issues, I feel them physically. There are pulmonary issues, there are cardiac issues, there are GI issues, and all of those similar GI, cardiac, and pulmonary issues can end up presenting more as behavioral health issues. So there's really this crossover there that goes on.
And what you have here is a way to identify each one and send people to the right place immediately without having to lose records and keep the information intact.
Well, and the other important thing is that you could have a very real cardiovascular illness and it be affecting you mentally as well. And the care of those two issues needs to be coordinated.
Okay, I understand. Now, who can use these services and what type of insurance covers the services that you provide?
So we're really contracted with the majority of payers here in New Mexico, and really anybody, primarily what we're goal-oriented towards is individuals who really do have those behavioral health concerns as well as the physical health issues, but really anybody that feels like this is really an ideal place to get care where you can have this wraparound in terms of behavioral health, therapy, psychiatry services, and family practice services.
I understand. Well, Dr. Sutter, Dr. Bryant, thank you so much for being with us. It's an absolutely tremendous service that you're providing. Everybody out here, if you want to find out more about this service, you just go to sageclinic.org or call 505-884-1114.